Hi, I'm Martina Tierney, Occupational Therapist and Clinical Director at Seating Matters. In the following short video, I'm going to look at why a footplate is essential for every chair. First of all, let's look at good posture and what is good posture. In normal or correct posture, the weight is taken evenly through both ITs, the spine is in midline, and the head is balanced equally above the hips, and the feet are rested in neutral. In normal posture, when someone is seated, 75% of their weight goes through 8% of the body. So it's very important that the body is fully loaded. The top 3 reasons why loading the feet is essential is number 1, for pressure management and pressure redistribution, number 2, stability, and number 3, to increase function. When a person is seated, 19% of their weight goes through their feet. This is almost 1/5 of the body weight. So it's vital that the feet are supported and loaded in order to redistribute weight evenly. The feet provide stability, and the person needs to have the feet loaded at all times. The third reason why loading the feet is important is that it encourages more function than the chair. In order to have function, we need stability. And when the feet are loaded, the client feels more secure and more stable and safe, and therefore they're going to become more functional. Also, by loading the feet, it assists with a stand transfer and encourages the person to stay independent for longer. We all like to feel grounded, and that's why loading the feet is important. The client needs to feel something beneath their feet because grounding for the client is essential. In order to load the feet properly, we need to ensure that number 1, seat depth is correct, number 2, seat height is correct, number 3, the back angle of the chair accommodates the hip angle, and number 4, that the tilt in space is at the optimum position for the client's function. With some of our more complex clients, sometimes the footplate needs to be adapted. One of the adaptations we can do on the Seating Matters chair is to accommodate plantar and dorsal flexion. This can be achieved by using an angle adjustable footplate. It's important to accommodate leg length discrepancy, so with the Seating Matters chairs we can make a special adaptation so that both feet are loaded properly. For clients who are at risk of pressure injuries, it may be essential to provide extra pressure management in the footplate. This is essential for clients that are bariatric, or for clients that have oedema of the legs, or maybe even for clients who suffer from diabetes. During assessment, there are times when we may need to use leg laterals in order to load the feet properly onto a footplate. As an occupational therapist designing specialised seating, I had certain criteria that were essential for every chair, and I didn't feel that a footplate should be an accessory or an option, and that is why with every Seating Matters chair a footplate is standard and essential and comes as part of the chair. The Seating Matters chairs have 2 types of footplate: the sliding footplate and the angle adjustable and height adjustable footplate. 20% of our body weight is in our legs, and when we consider a client with a bariatric condition, this is a substantial amount of weight going through the legs and the feet. So loading the footplate with the bariatric client is really essential. With the bariatric client, the footplate may need to be adjusted to meet their individual need. For example, if the client cannot achieve knee flexion due to increased adipose tissue behind the knee, we may need to extend the footplate. If the bariatric client is abducting the leg, we may need to increase the width of the footplate. The width of the footplate should always match the width of the chair. On our bariatric Sorrento, we take great care that the feet are loaded sufficiently, especially when the client is in tilt, as in tilt there's extra pressure on the abdominal area. However, loading the feet can reduce this pressure. If you found this video useful, like it, share it, and subscribe to our YouTube channel. For more details on this subject, you can have a look at our blog. For more tips on seating and also a guide to bariatric seating, request a free copy of the Clinician Seating Handbook.